A common question that we get from patients is, I have a positive pregnancy test at home, and now what's next? Usually the excitement level is through the roof at that point, and people are very anxious to get in the door. The way that we kind of do things here is they'll call that they have a positive pregnancy test, and depending on their history, we'll schedule them within a week or two, hopefully, to come get seen. The first appointment is usually with the new OB nurse, where we'll kind of discuss common problems from early in pregnancy. We'll discuss medications that are safe to take in pregnancy, give them a packet of information, and a lot of times that'll coincide with an ultrasound to see how far along they are. Usually after that visit, depending if everything's okay, they'll meet back with the doctor within a week or two to kind of schedule a new OB visit with the physician, where we'll kind of reinforce things that the nurse told them, and then do an exam and get their pap smear up to date if it's needed. After that, we'll start monthly visits until about 28 weeks, during which time we talk about various things that can pop up during pregnancy, and usually schedule an ultrasound somewhere around 18 to 20 weeks to see if it's a boy or girl, but also to look at the baby's heart, brain, and lungs, and all the baby's anatomy. After 28 weeks, we'll start seeing the patient every 2 weeks until they get to be about 34 to 36 weeks, at which point we'll start our weekly visits and cervical checks and until the day that they deliver. They'll come up with a delivery plan kind of towards the end of pregnancy if it's needed. One of the more difficult parts that we do here are taking care of people who have had previous problems during their pregnancies. For various reasons, they weren't able to carry a pregnancy or unable to get pregnant. And when that happens, I think the most important thing to do is to listen to the patient. A lot of times, just talking things and actually being able to counsel them about why these things happen or what they could do differently or what we need to do differently from our obstetrical approach, at least can help reassure the patient. And whenever those patients do get pregnant and deliver a child, there's nothing more rewarding for us or for the patient. So it's certainly the hardest thing that we do, but it also has the potential to be the most rewarding.